Now coming to Dacrocystorhinostomy operation. Dacrocystorhinostomy is an operation in which the any pathology inside the nasolacrimal duct or inside the lacrimal uh, sac, if there is dacrocystitis, acute or chronic dacrocystitis, or any tumor inside the nasolacrimal duct, so this can be operated by dacrocystorhinostomy. Dacrocystorhinostomy, the first step is the nasal packing. Nasal packing by a roller gauze which is soaked with 4% lignocaine and adrenaline. Then a incision is given from cheek towards the angle of the eye medially, so that the angular vein is not cut. It is a 2 centimeter 2 centimeter incision should be given, and one third remains above the upper one third remains above the medial palpebral ligament, which is a slip of the levator palpebrae superioris muscle. Now separate the skin, the orbicularis oculi, by lacrimal dissector. By the help of lacrimal dissector, separate the skin and the orbicularis oculi muscle, and retract all those skin and the orbicularis oculi by Muller's retractor. Retract it. Now the medial palpebral ligament is disinserted, or it is cut from the anterior lacrimal crest. So medial lacrimal ligament is cut by the from the anterior lacrimal crest. Now the lacrimal sac is to be removed from the medial wall of the floor. The lacrimal sac is removed from the medial wall and the floor. Now 10 millimeter bony ostium is to be cut through the lacrimal bone, and nasal mucosa of the middle meatus is exposed. So how will cut this 10 millimeter? By H-shaped incision. A H-shaped incision should be given, and 2 flaps anterior and 2 flaps posterior we have to give. Then the nasal mucosa of the middle meatus is exposed. After removing all the content, all the pus, all the debris and all the tumor, we have to suture those flaps by 6-0 or 8-0 nylon suture. The skin is again sutured by 5-0 or 6-0 suture, silk suture. Now 72 hours later, the nasal pack is removed. So this is all about the steps of Dacrocystorhinostomy.